everyone. Welcome to our January career development series. So today I'm really honored to have our speaker, Dr. Jose Suarez. So just a brief introduction, we got his bio in the email. Dr. Jose Suarez is an Ecuadorian doctor whose academic and research work has focused on understanding the social, economic, environmental, and cultural determinants of health within the context of imposed development models. These models have significantly impacted the health and living conditions of rural communities in Ecuador. And a key aspect of Dr. Suarez's work has been integrating academics, research, and community service. This approach has shaped the activities led by Fundación CIMAS del Ecuador, especially in rural areas, which he leads. So it's a real pleasure to have him present his work here, and I'm really excited to hear his work. And as I said before, please feel free to chime in the chat as well as after his presentation. So welcome.
Okay, thank you very much for the invitation to participate in this series that are really very relevant. Let me see if I can share my screen, just a minute. Are you seeing my presentation?
Yes.
Yes. Great.
Okay, so it was really a very challenging invitation, especially for me to share perhaps a complete different perspective of what the series might have been, especially since we are providing our experience from a third world country, from Ecuador, after working many years with the communities. So our perspective in relation to public health, epidemiology, research, academics has been shaped in very different moments of my lifetime. So from this perspective, I would like to share with you what has been a kind of a philosophical, epistemological, and social engagement that I have been having for many years. So my personal experience, I have been, I would say, very much blessed by different milestones that have opened opportunities for me to expand my professional career, if you will. So I begin to address that it's not only me as an individual, but also my circumstances that created different types of moments in my life. And I have been following very much Ortega Gasset, who is an Spanish philosopher that addresses the issue of life as a series of collisions with the future. And it's not the sum of what we have had in the past, but what we yearn to become in the future. And so I would like to start from what I consider perhaps the most important milestone. And that's the origin on a humble family of a tailor in a very small city, Ambato, in Ecuador. He started working after the death of his father at 9 years of age, and he quit the school. But when I began my childhood years, my father played a very significant role in bringing what he considered was the most important tools around education. One was typing, the other was math, the third one was English. And these three beginning tools in my first or second grade in elementary school really provided me with a very strong academic support. So math, I began to develop significant skills, and I learned with him that he purchased a book of mathematics, and we were learning together from simple arithmetic to calculus and everything like that. So he considered that learning about math was a very important tool to analyze problems. The other component was English. He considered that learning English was a very significant tool. And so after private classes, eventually I went to a center that was created by the US Embassy, that's the Ecuadorian North American Center, to teach English to kids. And I was able to go all the way up to the top. So this is something that has provided a significant personal tools, in addition to purchasing a monthly magazine that's called Life, that provided so many pictures around the global problems, the Latin American issues, the Ecuadorian components, and so on. And so just by reading every month from this magazine, I was able to understand the complexity of the global issues and global politics. Later on, I began to understand that this was part of the Cold War that was established after the Second World War. And so the conflicts between the communism and capitalism took place in many of our countries, including Ecuador. The United States had a very significant influence in what was defined the development of Ecuador after the Second World War. And so then there were significant components that happened because of this political intervention by the United States. For example, in 1963, a hospital ship, Hope, arrived in Guayaquil to provide training to medical personnel in Ecuador, but at the same time, they were sending medical missions to the different cities. In the case of Ecuador, I was perhaps one of the few translators that could provide assistance to the medical team. And so at that moment, I was able to see medical care, from ambulatory care to surgery. And so from my previous initial interest about becoming an engineer, I shifted into medicine. The second important component was that in 1964, several US AID members came to offer scholarships to the different kids in the towns. And I was able to interview, and I have good grades, I have a good English. So I was given one of the 3 scholarships to the students in Ecuador. This opened completely my perspective in relation to the world. It helped me to learn a little bit more about, let's say, a different culture, a different society, as in the case of the US culture. Upon my return, I went into medical school. So from my hometown, I moved to Quito, to the medical school. Another time, there was a strengthening of the design of the curriculum of the medical school, supported by the Pan American Health Organization. And they also introduced concepts of what was to become later on the Latin American social medicine perspective. So there was an introduction of biological and curative, as well as a social, economic perspective around health. Another important component from our culture is the presence of the family and the communities. And so in 1973, two important events happened. I got married to Loli Lopez, and I went to fulfill one requirement to do a social service in a rural area. So this was, I would say, both of these experiences were a life-changing experience. Living in a community, in a very poor community, without running water, electricity, facing the level of poverty, culture, and health in the locality provided, I would say, a very significant impact on our lives. So after that, there was a significant shift of what we were going to do afterwards. I went into public health, and Loli went into anthropology and social studies. Both of them were merging into what was to become the intercultural perspective in our academic lives as well as in our community activities. So I would like to highlight the importance of the extended family as part of the personal development. So, for example, these are some of the pictures of the different activities that we were doing in the field. So that was really what provided a wonderful experience in our life. At that time, we discovered the wealth of cultures, and at the same time, how the communities were trying to exercise and expand their own communities. So it became very evident now that social, economic factors, environmental factors were influencing the collective health. And at that time, we were, how can I say, introduced to the fiction Latin American literature, and we were living in the community very much of what many of the Latin American authors were mentioning. So we discovered and we began to expand our family under the consideration that this was our legacy that we leave on earth, not only material possessions, but they will be the ones that will keep our memories alive when are no longer together. So the idea, the cultural idea of the culture, of the family, of the community in Latin America, and especially in Ecuador and in the rural areas, is really very, very strong. And so we began to face, I would say, two different perspectives. My formal training in Western medicine, based on the notion of modernity, science, technology, that eventually were expanding pharmacological and surgical interventions, were in contrast with what was our experience in the communities with the ancestral medicine, based on the indigenous worldviews that are very much connected to nature, to Mother Earth, to sacred water. While the Western medicine developed the technology for diagnosis, for interventions and cure, on the contrary, the ancestral medicine was basing the notion of harmony with the human beings, with mountains, with rivers, with the species, with the spirits and ancestors as the basis of well-being and health. So the two perspectives are completely valid, and the main idea that we have been developing afterwards is how we may be able to link together. Then, around 1965 to 75, I was part of a research team on endemic goiter and endemic cretinism. this was really my introduction into research and the impact of medical policies like iodization of salt that were able to solve this problem. Then I went into my formal training with the support of the Pan American Health Organization to study in Mexico medical sociology, and afterwards MPH and PhD at the University of Minnesota. So this provided more sound support to my technical approach, integrating Western and traditional medicine. Afterwards, when we came back, I was part of the health ministry, but the important component was that in 1997, we developed the Fundación CIMAS del Ecuador in association with academic programs with the University of Minnesota. And so we have been developing these programs very much based around the Minnesota Studies in International Development for 33 years, integrating this perspective that we have been sharing to you about. Other universities had always sent students to our institution. Since the year 2000, we began working together, very actively with the Pedro Moncayo municipal government and the communities. And we were asked to develop the County Health Council, and we were providing the technical support. So the important component was a very strong participation based on the integration of health personnel and community members with the approach of participatory community-based research, understanding what was the relevance of the models of development, especially in relation to globalization, and some of the impacts were taking place locally. And one important component was the identification of pesticides as a very important risk factor for the community health. And so just to provide you a rapid information, the growth of the flower plantations oriented to have a commodity to export to the international market expanded, as you could see in the upper graph, the number and the surface devoted to flower plantations. Pedro Moncayo County became the most important flower exporter from Ecuador. And you could see in the bottom a map where the different plantations are located. Most of the plantations since 1985 up to 2019 were entrepreneurial plantations. So there were some national and international investors that were building these plantations that you could see in the picture in the lower part. But after the pandemic, many of the flower plantations were kicked off from the farms, from the big farms, and the only thing that they knew was to produce flowers. So they went to the banks, made little loans, and eventually they began to develop small family plantations that you could see in the upper part of the mountains. This complicated very much the problems associated with the flower plantations. While the flower plantations, the entrepreneurial flower plantations have some type of control, for example, child labor is not allowed. There are certain regulatory processes in relation to the type of pesticides. But at the flower plantation, at the family flower plantations, the whole family works. Children from 5 to 8, 15, young women, and so on, the whole family work. There is no regulation about the type of pesticides. So if they have a problem, they could go to to one of the chemical stores and purchase any type of pesticides. Sometimes they don't have the skills. So they buy one product that would affect one of the, let's say, bacteria or fungus or whatever, and they could buy 2 or 3 different products and make some kind of cocktails to apply to the flowers because they will be able to prevent everything under that perspective. So that created, I would say, a very clear example how globalization and the development of the plantations were affecting not only the living conditions of the people, but also directly affecting the environment, affecting the health of the people, and especially the child development, as we will be shortly presenting afterwards. So this is a very clear example of what has become to be known at the international level about the determinants of health. The determinants of health has been very much referred as the social factors or the economic factors or environmental factors, etc., or the cultural factors at the same time. But in isolation, from our perspective, we think that all of those health determinants are very useful if we understand that they are very much affected by a model of development. So this model of development of the flower plantations clearly is reflected in the different indicators of the health determinants of health. The other component that we learned during this process was the relevance of the community participation. So the County Health Council was the integration of about 40 people, 20 of which came from the government and from the health facilities, and 20 came from the different small governments and the communities and the second degree of community organizations and so on. So there was a very interesting participatory process. This idea of participation, the importance of community lies in providing a sense of belonging. And since I mentioned before, community is so relevant in our culture, especially in the indigenous culture, it provides emotional, social, and economic support to the people. It creates a network of mutual care and solidarity. It strengthens the identity and fosters the networking that could be conducted locally. And in this way, they are trying to work towards a better collective well-being as a shared goal by many people. The assumption is that this community intervention could reduce the health and the social inequalities and improve the determinants of collective health. So this is another very important lesson that we have been able to learn in this process. One interesting integration was, as part of the County Health Council, the development of a community georeference information system that integrated more than 200 variables at the different communities, families, and individuals in the county of Pedro Moncayo. This system obtained the first prize in an international contest looking for public health solutions for equity based on ICT approaches in Latin America and the Caribbean, conducted by PAHO, IDRC from Canada, and the University of Toronto. So this has been a very important tool for the planning process for the identification of the vulnerable groups, and therefore the interventions could be localized. But of course, that meant some kind of political support to address the problems, at the same time to obtain enough economic resources for the interventions really to take place. So the two things go together: resources, interventions, the information system, and so on, in order to measure what would be the impact of the different interventions. But because of political crises, economic crisis, very often we were not able to obtain the resources that we needed for the interventions. The other component that took place at the County Health Council was just a conversation among the different people, and they began to refer, well, the nephew of a friend over there, a child developed leukemia. There was another lady that had stomach cancer, another man that died because of upper respiratory infections and whatever. And they began to hypothesize that perhaps the high use of pesticides in the flower plantations may be the cause of the cancers, congenital malformations that they are seeing, and so on. And they began to wonder if really the pesticides may have some significant impacts. So this became one of the priorities in the county health plans. So this is stimulated for a future research that became the SPINA project, that was the study of the effects of secondary exposure of pesticides on children, adolescents, and young adults. At the time, our son, and we come back again in relation to the notion of the family, our son, José Ricardo Suárez, he was doing his research for a PhD at the University of Minnesota. He developed and designed this project and was able to obtain support from NIH to conduct his PhD thesis. And after that, he has continued to update the proposals, and at the same time, he moved to California, to San Diego, California, as faculty and researcher. And since then, we have had a very strong collaboration from UCSD and CIMAS to develop this longitudinal study from 2008 to 2026, and we have presented an updated proposal for the following 5 years. We have been following a cohort of 500 participants. When they were 4 to 7, then later on they became adolescents, and now they are young adults. So there is a community effort. So the research process links with the local information system, with the communities organizations, to bring together the participants at the moment that we need. So this strong ties facilitated, I would say, during all these years, the collection of data. Finally, part of the idea that we have been having all along is that we have to obtain information to produce certain type of transformation that could improve the living conditions of the people and the health conditions of the people. And so, as Fundación CIMAS, we have been part of the municipal government to the parish governments since 2000. So we are 25 years working together with them, helping in the development, in the design, identification of needs, the design of intervention activities that became to be known as the development plans, that integrate different intervention activities that the communities and the authorities consider are the most relevant. So the last one was conducted just a year ago, and we have the plans for the different parishes, as you could see here. So now, trying to summarize what I have been presenting to you is that, of course, technology, diagnostics, and medical interventions are very important. But the second component, that perhaps the Western medicine is not very strong, is that health promotion should be really expanded. And then this idea of the indigenous wisdom, that harmony is so important, harmony within human beings. But now, the whole world is in a crisis of violence, of war, of crimes, different type of crimes. There is no harmony with the environment, with Mother Earth, with sacred water. So the environment has been affected. Global warming, and wherever we go, we find deforestation, we find fires, like in California now, there are floods all over the world and so on. And so this wisdom associated with the notion of harmony also integrate the spirits. So some of us may have perhaps certain type of feelings in relation to different gods. In this case, their spirits, the indigenous spirits, are associated with the mountains, with the rivers, with the forests, with the different fauna and flora. And so the idea of taking care of nature is at the core of the indigenous wisdom. So integrating the scientific and technological development with this broader perspective in relation to what would be health promotion, I would say should become a very important component of training of all levels of education, from elementary school, high school, universities. And now that some of the fellows that are being funded with a scholarship from GloCal perhaps may have a little additional seed to include in their personal growth, in their academic development, in their career development, to integrate the cultural components, integrate the main social, health, environmental, cultural, political determinants of health in their perspectives, in their training. So we have been developing this type of vision, not only to construct an alternative vision of health, but also an alternative construction of life. And we develop this different type of construction of life based on harmony. We will be able to improve the health and well-being of all the world communities. So the new generations will have to continue building their careers on the experiences that have been created. So this is what I have wanted to share with you. That's not exactly the scientific perspective that perhaps you might have been expecting, but on the contrary, to provide, I would say, a different worldview, a different perspective in relation to health. And with this different perception of health and perspective of health, you are also growing as as a human being from philosophical perspectives, from epistemological perspectives, and, and especially with the social commitment that we have to have in order to generate alternatives for the people. So at that time, you are integrating a circle with your family, with your community. And so I have been mentioning the part of family that perhaps may be more private, because we are really very proud of Jose Ricardo becoming a professor and researcher at the University of California, San Diego, and he's becoming a known expert in relation to pesticides. And we are proud of it. So thank you very much.
Great. Thank you so much, Jose. That was really inspirational, and I really appreciated you sharing your journey and the the work that you've done. Um, I want to open it up to our trainees, but I wanted to just get started with like the lens in which you work, in terms of how we, integrate like Western approaches to, the local as well as like meaningful community involvement in the work that you do. So I guess one question is, just thinking about our, like, if we think about just National Institute of Health as our funder, um, I think we still have a long way to go in terms of them appreciating this model. And we've had challenges in terms of proposing studies that are not like developed by academic researchers. If it's co-developed by community partners, we often get pushback from our NIH funders. So I guess my question is, how do we move forward to kind of change the paradigm and, change the institutional like barriers to, pursue the work that you are doing?
Well, I would say that that has been a challenging issue for decades, probably centuries,
Mhm,
where the findings of research probably are not really easily recognized,
mhm,
either by the political structure of a country or the world, or by whoever have the funding to support the interventions. Uh, for us, it has been a very significant challenge because now, probably you must have read that Ecuador has been having so many economic crises,
mhm,
so many recent crises in relation to violence associated with narco trafficking. And so the whole situation of Ecuador is really very unstable at this point.
mhm,
So we have been waiting for several months to do something that we already did a year ago in Pedro Moncayo County, when we developed what we called a scientific coffee, or a scientific breakfast, I would say,
mhm,
where we invited many of the authorities, many of the community leaders, and we had a colloquial presentation of the main findings of the SPINA project. It was surprising for many of them.
mhm,
Many of them were kind of aware, but when we presented the data, they became quite scared. But then we came to face a new type of contradiction. Yes, we know that pesticides affect our health. We know that the flower plantations are affecting, again, the environment and our health. But that's our only source of income. either we die of poverty or either we die of cancer perhaps sometime in the future. And so the idea of the family flower plantations faces this contradiction. We are not against the flower plantations, but we are against about the high use of pesticides. Who is going to control that? Who is going to really stimulate the changes from a pesticide flower production into an organic flower production, which is feasible? And there are different interventions that we have been developing with the local planning to reduce the risk, reduce the use of pesticides. But a little county, a little parish, is very difficult to face the big enterprises behind the flower plantations or the big chemical industry. Mm-hmm. And so we have been trying to organize a similar breakfast in Quito, inviting the ministries, inviting the international cooperation to begin to see the complexity of the problem. Mm-hmm. Yes, there are, as I said, there are environmental problems and so on. There are health issues that have been clearly identified. Mm-hmm. But we have a plan. In the plans, there are interventions. Who will fund? The government? The international agencies? So far, we are working, trying to place different projects at different levels. We will have to see if in the coming 2-5 years, we are able to obtain some resources to start this type of interventions. And so worldwide, at least there is a discussion in relation to the determinants of health, looking also in relation to broader pictures. But when the allocation of resources come, they are not always available at the international level. So I don't know, this is really a very, very complex issue that all of us, we have to start thinking about how to overcome.
Yeah, well, thank you. So we have 2 questions in the chat. Let's see. First one's from Kelly. Kelly, do you want to unmute and ask away, or do you want to?
Sure. I really enjoy this presentation because my background, my PhD is actually in community development, and my work aims to kind of bridge community development and global health. So I'm curious about what mechanisms you use in your program development and your interventions to give that voice to the community beyond those of even local government institutions, particularly in some of these LMIC, in these resource limited settings where government institutions don't always speak to the will of the people or the will of the community. So I'm just wondering what you do to get beyond that.
I would say we have been doing, how can I say, small projects. We are also Rotarians. So we have been able to obtain some Rotarian global grants. One was to develop a training center on agroecology, which has been really functioning very, very well until the pandemic came, and then many things were affected in relation to the center, especially because the peasant families that were coming to the center to have the training, eventually they considered that they obtained COVID by the participation. Of course, that COVID was all over the communities, but anyway, they rejected continue with the participation at that level. We also obtained a global grant to develop a small micro lending for small projects, especially for women. And they have been highly, highly successful, and they have expanded so much. Let's say the initial seed money is now they are managing funds for 20 times as much. Now we are submitting a new proposal, especially to develop youth enterprises, partially to provide support to our own SPINA participants, and at the same time to other young kids in the area. So this is a process that we are negotiating with the Rotary Foundation about funding us. We are going to have a visit within 2 weeks by one of the members of the Virginia Rotary Clubs that are interested in supporting this new project. And now we are also preparing a set of different projects to be submitted to different funding calls, like, for example, USAID, by the Inter-American Foundation, by the United Nations organizations like the Global Environmental Fund, and so on. So that's what we are trying to find as an alternative way to obtain some resources. From our experience, you have to develop 10 projects, and you are lucky if you obtain funding for one. But we have the data, we have the structure here as within Fundación CIMAS, as well as with the communities, and there's a network with the local governments that perhaps may allow us to obtain some additional resources. So that's how we are seeing we could perhaps contribute to find the intervention activities in place in the county. Thank you, Kelly.
May I ask a follow-up question? You brought up some of the microfinancing for women, and I'm curious. There's been a lot of backlash in Bangladesh with Eunice's work. There's been a lot of criticism for putting women in very vulnerable positions with these microloans, and I wonder if you've had any of that experience. Have in some of these situations where women are still at the mercy of patriarchal family units. It's made women very vulnerable. And I wonder if you've had that. Have you had that work? Have you been exposed to that, and how you've dealt with it?
Perhaps the design might have been a little bit different, because the funding was going to fund, of course, women, especially women, but not only women, but associated in what we define as the community banks. So perhaps a group of families, maybe 10, 15 families, get together, and especially conducted by the women of those families, get together and organize this kind of community co-ops, I would say. So they receive the funding, and all of them are responsible for paying back the funds. And so the funding is allocated according to what they agree. They go a certain amount to one of the women, another funding to another woman, and so on. And it has been so successful, there is zero, how can I say, delay of payment. So they have been paying quite a lot. And the system is working in such a way that they have to pay interest. And it's a high interest. But that interest comes back to the scope to expand the capital. And so month after month, they have been circling all the resources and expanding with the interest. And in this way, if the initial source was $50,000 funded by the Rotary Foundation, now they are having a general fund of more than $2 million. So I would say this model has been really, I would say, very, very successful and part of this new global grant to develop youth enterprises will be also following the same design. So the same women are checking on those that are having difficulties in paying and providing support for them to be able to repay. So I would say that has been running for 10 years already. And it has been very, very successful.
That's outstanding. Thank you.
Yeah, thank you. So there was another question by Araceli, but she mentioned that you have answered the question. We have just a few more minutes. Any other questions for Dr. Jose Suarez? This has been really interesting and inspirational, so I really appreciate it. Any final thoughts, questions? And Jose, I welcome you to California anytime when you get a chance.
Yeah, sometime in this year, I don't know how soon, but yeah, we will be going there.
Great.
So since there are no more questions, I really appreciate very much the time that you have given to listen to my, I would say, different ideas, perhaps, from what would be the Western paradigm. But if you come by Ecuador, we will be happy to receive you. We have a very adequate environment for our academic classes with different universities. So if some of you would like to do a sabbatical in Ecuador or do a research in Ecuador, whatever, we will be happy to support.
That's great.
So
Well,
thank you very much.
Yeah, well, thank you. Thank you for your generosity as well. So maybe I'll take you up on that offer and escape the fires in LA.
Wonderful.
All right. Well, thank you all. And Kimberly and Julie, do you have any final announcements for our trainees?
I don't think so.
Okay.
Just keep reading all those emails we're sending you.
Okay. Great. Thank
Thank
you,
you, though.
everyone.
Thank you so
And
much,
stay
Jose.
safe and be well. Okay.
Bye.
Bye.
Thank you.
Thank you.
Bye.
Goodbye to all.
Bye.